Hello, today we'll deal with Olanzapine intramuscular injection that we give for patients who have schizophrenia. So we have a patient now who have been taking oral tablets many weeks. So this patient is stable on oral tablets, but maybe he's not following the rules, he's not taking the pill every day as he should, so the compliance is bad, or that the levels are spiking and getting less and high, so there are ups and downs in the level of this medication in the body, which is usually the case with oral tablets. It can happen due to stress, due to certain bodily functions, bodily rhythms that you have in your body, and therefore we have seen that intramuscular injections are much more stable. The level of this dose of this medication will be more stable than orally. So therefore we will give an intramuscular injection every 4 weeks. And it is very convenient now because the patient can get totally 12 injections a year instead of taking 365 tablets a year every day. So now Olanzapine, we have a trade name called Zyprexa Relprev. Zyprexa Relprev. Okay, we have then dose of 210, 300 and 405. These are the doses we can use. We always start with the lowest dose, but we need to consider what type of oral tablet did he take? Did he take 10 milligram? Did he take 50 milligram? What dose did he take? Because according to that, we choose the intramuscular injection. For example, if he took 10 milligram Olanzapine, then we will give 210. If he took 15 milligram of oral tablet Olanzapine, then we will give 300. We will start with 300. And how do? We do an intramuscular injection of, let's say, 210, and we don't need any overlap with oral tablets, as we had, for example, with other medications or with other antipsychotics. That meaning that you don't need to continuously give oral tablets overlapping this intramuscular injection. You just give an intramuscular injection and you stop the oral tablet. You just move it away. That meaning that you have a stable dose just right in the beginning. For some other medications, antipsychotics, we need an overlap, for example, for 2 weeks or 3 weeks or 1 week. But here in Olanzapine and Zyprexa, we don't need any overlap. Good. So we start with 210. And first of all, we give 210 every 2 weeks up to 8 weeks. So it means you give it up to you reach 8 weeks. And then after that, you increase the dose. So for example, if you had 210 for 8 weeks, then you will give now 300 every 4 weeks from then on. Okay? So once again, if the patient is taking 15 milligram of oral tablets of Olanzapine, then we start with 300 milligram, not 210. We start with 300 milligram. We give 300 milligram every 2 weeks for 8 weeks. And then after 8 weeks, we increase the dose to 405. And you give 405 every 4 weeks from then on. And that will be our maintenance dose. And it is important that you monitor the patient after you made the injection. What does this mean? Because when you do an injection, there have been some studies showing that in around 1% of cases, you have something called post-injection delirium sedation syndrome. As the name suggests, we have a post-injection, meaning after the injection, you get a syndrome. Syndrome is a constellation of symptoms of delirium and sedation. Delirium meaning anxiousness and confusion and so on. And you have sedation, meaning you have a very tired patient, a very sedated patient. So these two symptoms together make up this post-injection delirium sedation syndrome. And you only see this in around 1% of cases. And why? It has been shown that sometimes the doctors unfortunately puncture not the muscle itself but the vein, and the medication goes into the vein somehow. And this is a theory that this is the cause of this syndrome, that the medication should get into the muscle and not into the vein. So usually what doctors usually should do is that when they puncture the muscle, they should extract a little bit, so they should not put the whole stuff in the muscle. Before that, they make the syringe a little bit backward, so it's making a vacuum, and then it sucks any blood that is coming from the vein if you are in the vein. If you are not in the vein, then nothing will come, and then you can proceed and inject the medication into the muscle. So, but otherwise, we have to anyway monitor the patient for 3 hours after you made this injection. please make this a rule with Olanzapine, so with Zyprexa. Once again, the doses are 210, 300 and 405. We start with the lowest dose with 210 if the patient was taking an Olanzapine of 10 milligram. But otherwise, if he's taking 50 milligram, then we start with 300. And how many weeks do we give it? For 8 weeks, we give it every 2 weeks, we give this lowest dose, 210, 210, 210 for 8 weeks. And then after that, we switch to higher dose, which is 300. And then we give it every 4 weeks. As we said, you don't need any overlap, so you don't need to continue the oral tablets with this type of medication, so you stop the oral tablets. Otherwise, the dose will be too high. Okay, so I thank you very much for listening, and hopefully you now understand how Olanzapine works and what doses you have and so on. Thank you very much. Bye-bye.